I am asking Mount Sinai Hospital to look into this matter with Elmhurst Hospital. That is a sister hospital that's underneath you. Why are they infecting your workers and medical staff, corrupting them like they are, to involve them in their negligence? I'm asking the board at Mount Sinai Hospital to investigate why Elmhurst Hospital did not send me to Mount Sinai when I requested it. I had head trauma, eye trauma. My neurologist is at Mount Sinai Hospital. Why did they want to send me to any hospital other than Mount Sinai Hospital and claim that Mount Sinai Hospital did not have a surgeon? This is outrageous. I am a human being. How could someone act so unethical? And they call themselves doctors. Their license needs to be revoked. I do not want to hear they are students learning. No. That is not correct way of doing it. And then for your staff to act like Elmhurst Hospital and listen to them. They're talking to them. Again, Mount Sinai, the board, staff, chief of staff, please investigate this case. I have head trauma, eye trauma. I'm walking and I'm veering off. I was knocked out for 3 hours. I went to the hospital at Elmhurst and told them that. And they had me sitting there. The nurse, the triage nurse, knew it was an emergency and sent me in the back. They took an EKG with the heart and then sent me in the back, and no one seen me. I'm sitting there dazed, not knowing what's going on. And then when I realized, hours later, I said, let me get an administrator. Give me an administrator. I asked the administrator for a doctor because of my condition. And she said, I have 37 patients ahead of me. Elmhurst Hospital is a trauma hospital. I was a trauma patient. Elmhurst Hospital did not want to send me to Mount Sinai because then they would realize something was wrong. But yet still, they're hiding under you and got other hospitals involved in this. As I mentioned before, they got your staff involved in it. Why would a resident and an MS call Kings County Hospital, whereas the doctor there at Mount Sinai said, don't worry, we're going to take care of you? When does Mount Sinai Hospital call another hospital a city hospital? It doesn't sound right. What went wrong with my CAT scan? What was the problem? Yes, it was negligent. But to say that Mount Sinai, you did not have a surgeon to do eye? An eye surgeon? There's one on call. Why would they want to send me to a hospital that doesn't have my record and say, oh, we'll get in contact with Mount Sinai neurologists. We'll email that doctor. No, send me to my doctor. Elmhurst Hospital didn't even do an EEG to monitor my brain waves to see if something went wrong. There was a lot of negligent malpractice, intentional emotional distress to protect them for the wrong they did when they did not see me, a trauma patient. I am having my problems with Elmhurst Hospital. I'm trying to get an attorney to have a case against Elmhurst Hospital, not against Mount Sinai. But Elmhurst is hiding behind Mount Sinai Hospital. And I'm asking you to tell them they are on their own on this matter. You are taking in a hospital that's going to have a lot of lawsuits against them. I'm asking you, Mount Sinai, again and again, to investigate this, the board to investigate this. I am asking the public, called Department of Justice, to call the human rights. They have violated my human rights. I'm a human being. I am not a test subject for a resident to practice on my eye. This has to stop. What is the hatred? Because I gave my opinion, my right as a female, and told 4 male residents, no, I am not going where you want to take me because the correct hospital is Mount Sinai, and then I get treated like this? This is wrong. It's inhumane. I'm asking attorneys to help me. They want to send me for a hearing, which Elmhurst Hospital has control on. I prefer to have a mediator and say either you want to settle or not and take it to the Supreme Court. But no, this isn't what they want to do. They want to take it to another level and have a sanctuary hearing, which consists of a judge, and the people from the public can go there. And then it's hard to appeal that. And then have a judge say, oh, you can't submit this in if you go to court. You can't submit that in if you go to court. No. This is what Elmhurst Hospital is doing, is to have all documents and proof against them not to get submitted into a Supreme Court civil case. This is not right. I'm asking, please help me. And then when I did come home after the surgery, what happened? I get a call.
Less than 3 minutes to record. You have 29 old messages. Thursday, 9:51 a.m.
Hi, Ms. Riles. This is Chris from Crimer & Crimer calling in regard.
Less than 3 minutes to record. You have 29 old messages. Thursday, 9:51 a.m. Wednesday, 8:35 a.m.
Hi, good morning. This is the Kings County Hospital iClinic. This is Dr. Joseph Davis. We're expecting you today this morning. If you give me a call back, my cell phone number is 848-667-3253. Again, my name is Dr. Davis, and my cell phone number is 848-667-3253. We're expecting you in the retina clinic today. So just give me a call whenever you have the possibility and make sure that you don't eat anything this morning. Thanks so much. Have a nice day.
Wednesday, 11:03 a.m.
Ms. Gwendolyn, my name is Nancy. I'm a review coordinator at Levanta Quality Improvement Organization for Medicare. I'm calling in response to a message that we received from you while you're at Elmhurst Hospital. I am unable to follow up with you there because, one, you didn't leave a room number, but also was not sure if you had been transferred to the other hospital, Kings, I believe it was. Once you get home, if you would like to follow up and pursue this complaint, please give us a call back at 866-815-5440. Again, my name is Nancy, review coordinator at Levanta.
Wednesday, 4:22 p.m.
Hi, good afternoon. This message is for Ms. Riles. My name is Lisa Fontanez. I'm calling from Patient Relations at Elmhurst Hospital. When you have a chance, if you would please return my call. I just wanted to follow up with you on some of your concerns that you had here, okay? I can be reached at 718-334-3690. 718-334-3690. Thank you.
What is the problem? Why is everyone want me to go to Kings County Hospital? Why is that? And the doctor from Kings County Hospital calls me. I'm still at Elmhurst Hospital. And this is the hospital you want to deal with, Mount Sinai Hospital. I asked the patients of Mount Sinai Hospital, the board, to say no to this merging of Elmhurst Hospital.